Hello everyone, this is Dr. Bishal Gyawali from Queen's University, Kingston, Canada. And today I'm back with a new video on our series of Skills Lab, How to Interpret Clinical Research with Dr. Bishal Gyawali. In my last video, I discussed about some background information before you start reading the paper. So today we'll discuss about, okay, now we start reading the paper. And so what's there at first when you start reading the paper? There is the abstract. So the question is, do you always have to read the abstract? And that's an important question. When do you read the abstract? I don't think you have to always read the abstract, but there are some occasions in which I read the abstract. So one is, if that's a new topic for you, then to gauge whether or not you have interest in that topic, whether or not you want to read the full text, that's when you read the abstract. Because I don't want anyone to make clinical decisions by reading abstract alone. So I discourage people from reading abstract, except in 3 occasions. One is when, just to get an idea about whether or not you want to read the whole paper. Before you spend time reading the whole paper, maybe you want to read the abstract to see if you are interested or if that is relevant to your topic. 2 is after you have read the full article and after you have made a clinical or scientific judgment about the article, then you can read the abstract to get some quick data points. And what do I mean by that? For example, I see patients with colorectal cancer in my clinical practice, and there is a new trial published, and I have read the full article, and I have made my own judgment about whether or not I should be using this drug. And let's say I made an informed decision that this drug is going to be useful for some of my patients, and now I have a patient in front of me in the clinic, or maybe I'm going to see that patient tomorrow in the clinic, and I'm going to use that drug. So in that case, to get quick data points to answer patients' questions, for example, what would be my median survival if I take the drug versus I don't take the drug? What would be the effect on my quality of life? What might be the major toxicities? To answer these quick questions, those quick data points, I will go back and see the abstract because I have already read the full paper. So I'll go back and read the abstract. And third, for research purpose, I do a lot of meta research where we gather data from different papers. So in those cases, I read the abstract. But I never make clinical or policy decisions based on reading the abstract alone. And I'll show you a quick example of why I'm so critical about making decisions based on reading abstract alone. One is because in some of the journals, as I discussed in my last video, conflict of interest information is so important. But in some of the journals, they don't provide that information within the abstract. You have to have access to the full text just to see conflict of interest of the authors. But that's not the main point. The main point is there can be a lot of spin in the abstract. So I'll give you one example here. This is the conclusion of one of the abstracts from a phase 3 clinical trial of a new cancer drug in pancreatic cancer. And if you can see this conclusion, you'll see that there is a huge amount of spin into this conclusion. It says, although hazard ratio was in favor of the drug, there was no statistically significant difference. PFS2 showed a clear trend, but was not alpha protected. This is all jargon. If I was to summarize this conclusion in a single clear sentence, it would be the drug failed to show any clinically meaningful benefit in patients. That would be the clear conclusion. But that conclusion has been spun in such a way that you will get an impression if you read this conclusion from abstract that this was a really good drug, which is absolutely the opposite conclusion of the reality. So watch out for abstract conclusion, especially the conclusion of the abstract. Don't rely on them. And actually, I have a suggestion about this for the journals. I think the conclusion of the abstract should not be written by the authors of the paper. Someone else should write this, like an independent expert, an independent third party should be writing the conclusion of the abstract. And in fact, a Journal of Clinical Oncology, in their context section of the original articles, and I'm going to give you an example here, they have a section called relevance, And that relevance section is not written by the authors, but it's written by the associate editor of the journal who reviewed that paper. So similarly, I think it is important that journals make an independent expert write the conclusion of the abstract instead of letting the authors write the conclusion of the abstract. So talking about an independent expert writing the conclusion of the abstract, some of the journals do publish editorials to accompany these important trials. And those editorials can make big influence on how we interpret the results of the trials. However, I encourage the audience to read those editorials only after you have read the paper for yourself. So don't trust the experts blindly. Don't trust the majority opinion. In social media, for example, after a drug trial is published, there will be several tweets and people will have hot takes, but read the paper for yourself. There can be huge bias due to big names. You see these big names supporting the drug or saying things in support or against the drug, but don't get influenced because of those big names. Be aware of experts, because experts don't always give better advice. They just give more advice. And I'll give you an example. So in this trial, patients received a new drug versus placebo with the goal of improving muscle mass and muscle function for patients with cancer cachexia. And as you can see, the results of the trial show that if you get the drug versus you get the placebo, then you gain some skeletal muscle mass, almost 1 kilogram gain of muscle mass, compared to losing almost 1 kilogram of muscle mass if you get placebo, which is statistically significant. But what is clinically meaningful for the patient? Does having 1 kilogram extra muscle mass mean that much more for the patients? No, it is the muscle function that is important. So they looked into muscle function as well. And if you look at the data for muscle function in terms of hand grip strength, there is no difference. So what these results mean is that if you get the drug versus not getting the drug, you will have 1 kilogram extra skeletal muscle, but your ability to open the door or button up your shirt will not change. So what sense does it make to get a drug that just improves your muscle mass but does not improve your muscle function? That was my impression. But the conclusion of that paper was that this is a treatment option for patients with cancer cachexia. And I was surprised. Why would they conclude like that? And based on my previous video, of course, I saw that the paper was written by the industry, as you can see here. But then I was interested in the editorial, because the editorial is supposed to put things into context and provide correct inference. But when I read the editorial also says that actually this drug offers new hopes for our patients. And I was surprised. Why would the editorial also conclude in such a positive light? And then I looked at the conflict of interest of the person who wrote the editorial, and I was surprised to find that the person has received fees from the exact same company whose drug was being discussed. Exact same company. And that got me intrigued, and we did a systematic study to see how prevalent this is and how does it affect the interpretation. And we published this paper in which we found that if the editorialist has received money from the exact same company, which we define as direct financial conflict, then the editorial is going to be unduly favorable for the product. So our bottom line expectation from journals or conference organizers is that at least the editorials for the journals and plenary discussions for the conferences, at a bare minimum, should not be receiving money from the exact same company whose drug is being discussed. So that means don't rely on conclusion of the abstract. Don't rely on editorials. There can be huge spin and bias. So interpret the data for yourself. In the next video, we'll go in details about the introduction and methods. This concludes the abstract section.